So officially, let me welcome you to the State of Prescription Delivery brought to you by ScriptDrop. For those of you that don't know me, my name is Luann Myers, and I am the VP of Business Development. And with me today is Emily Muenchen. Emily is in charge of our wonderful account management team. And prior to coming to ScriptDrop, she has a background in nursing. So getting patients on their medication and being adherent is really a cause that is close to her heart. So today she will be functioning as our content expert as we go through the presentation today. So we'll go ahead and go to the agenda. And I know based on registration, I'm really seeing kind of two themes with the attendees. So one are folks that don't do any delivery today, that are really looking for insights on how to create or build a program that's good for both your patients and your pharmacy staff. And then we've got folks who maybe have an in-house driver or doing something today, or might even be a ScriptDrop current customer. There's also going to be some good details for you guys as we talk about what are some of the trends that we're seeing in the industry. But the agenda specifically will be why delivery is necessary. And then we'll go through what are some characteristics of a useful delivery solution. And then we'll talk through current industry players. Now, I will say, due to the large number of attendees, we do have everyone muted. We will have a section at the end for Q&A where you can just send your question to me via chat. But if you would like to send questions in real time, if it's in relationship to a slide that Emily's talking about, you can send that chat option if you just look up chat and put in Luann Myers, and then I will present those questions to Emily in real time. So with that, I will hand it over to Emily to talk about why delivery is necessary.
All right, thanks, Luann. And thanks everyone for joining us today. When you think through the problem of prescription access and adherence, prescription delivery is a really great bridge for both patients and healthcare providers. Today, we aim to give you insights into prescription delivery and how it will continue to be a valuable aspect of patient care well beyond COVID. It's easy to imagine why prescription delivery boomed in 2020. COVID-19 changed the behavior of nearly the entire world. It feels like forever ago, but if you can, think back to 2019 and compare it to 2020. Did you personally opt into delivery more than you had previously? With dinners from DoorDash, ClickList at your local grocery store, or Amazon orders for literally everything else? But the question is, will delivery remain as important in a post-pandemic age? So think again back to your own changed habits. Which ones of these are you willing to give up and revert back to your old way? And which ones are here to stay? I know in my household, the Amazon boxes definitely haven't slowed down, even though we're perfectly capable of running errands again. We're adopting delivery into our lifestyles, and healthcare isn't excluded. Patients are demanding delivery, and they won't accept the old way in every situation. Some patients simply want delivery since they've become accustomed to it, but others truly need delivery for reasons we'll talk through here on this next slide. So we could make a broad statement that every patient can benefit from delivery, and there's definitely an argument for that. But instead, we wanted to pick out a few patient populations who might need delivery. So looking back at 2020, 25% of patient consultations during the pandemic were telehealth visits. So sending those patients to a pharmacy to pick up medications after that telehealth consultation is definitely an interruption to their continuity of care. So if you think about it, if someone's too sick or lacks transportation to make it to an office, or maybe they just prefer that non-contact visit, driving to the pharmacy would prove just as difficult or unattractive to those users. Then imagine if you had a telehealth visit for maybe a migraine and the physician wrote you a prescription. Your head's throbbing, sensitive to light, you're nauseous. How would you safely make it to the pharmacy for your medication? Telehealth helps bridge that gap for patients in traditional healthcare, and delivery is a really great complement to that care. Now, looking at older adults and caregivers, in the year 2034, the number of people 65 years of age and over will outnumber those 18 years of age and younger. This demographic shift to an older population will inevitably affect our healthcare system. Additionally, adults over 65 are more likely to have multiple maintenance medications or be cared for by a caregiver. At ScriptDrop, for example, pre-pandemic, 30% of our deliveries were signed for by a caregiver, and our average age delivery was 72 years old. So helping the senior population stay on their medications will help them remain healthy, and it takes that additional errand of running to the pharmacy off the plate of the caregiver. And then life circumstances can often prevent caregivers, or any patient for that matter, from having time to run to the pharmacy. We're all working long hours. Some people live too far away from their pharmacy, or they lack a car or reliable public transportation, or we're simply busy with kids, school, work. All of these things could keep us from heading to the pharmacy to pick up our prescriptions on time. There's a lot of pressure on us to do more in a day, but we never seem to get more time in a day. Plus, it's natural to think you can go without your prescriptions if maybe you're feeling better, you don't feel your symptoms, or you're too busy to prioritize self-care and your health. So opting into delivery can make it easier to stay compliant when the medications come to you. You know, when life gets hectic, a lot of us would do anything to free up just a little bit of time for something else that needs our attention. And when you look at patients through the lens of empathy and meet them where they are, delivery is an obvious answer and can have a huge impact on the health of patients. We dove into the success of a few of our partners to see what the true impact of delivery has been for them and their patients. So looking here, both Total Healthcare and Denver Health are federally qualified health centers that help care for underserved communities. They've strategically paired delivery with specific disease states and at-risk patient populations in order to increase medication adherence. So Total Healthcare, they had been struggling with high rates of prescription abandonment. They recognized that people weren't making it to the pharmacy for their meds, which meant they couldn't be staying on their prescriptions or as healthy as they could have been. And oftentimes they were ending up back in the hospital. 42% of Americans have not one, but multiple chronic conditions. Many chronic conditions are controlled with daily medications. And when prescriptions aren't being picked up, it's often multiple chronic conditions that aren't being treated then. So unfortunately, you know, some of the side effects that come with these chronic conditions can be physical or mental obstacles for the patients. Some chronic illnesses cause things like fatigue, pain, balance issues, shortness of breath, and other patients might just be really private about their health and feel uncomfortable interacting with the pharmacy staff. So by offering delivery, Total Healthcare was able to reduce their abandonment rate by 88%. And Denver Health was already offering delivery, but the efficiencies ScriptDrop was able to offer them in their delivery system allowed them to increase their delivery volume, which helped patients, more patients, and decreased their internal admin costs.
So Emily, we did have a question come in. So looking at the two success stories of Total Health and Denver Health, they both seem to be health systems. So we had a retailer ask, you know, are you only working with health systems, and maybe more specifically only FQHC? Like, what are some other entities that you work with today?
Yeah, that's a really great question. So ScriptDrop, we want to work with anyone in the healthcare space who wants to remove barriers for the patients and increase patient adherence. So we'll work with health systems, as you stated, especially the federally qualified health centers, but we do work with a lot of chain pharmacies, independent pharmacies. We've even seen some payers interested, pharma programs, really anyone who wants to increase the access of medications to their patients is someone that we want to talk to.
Great, thanks.
All right, so next, our entire health system benefits from patients staying healthy. And we just talked through the specific benefits from Total Healthcare and Denver Health, but abandonment isn't just a problem for those two health centers. 1 in 5 meds aren't getting picked up from the average pharmacy. And that has a ripple effect throughout our entire healthcare system. There's research showing that certain drugs are typically abandoned if they aren't picked up within the first 72 to 96 hours after their initial window of when they're ready for pickup from the pharmacy. So identifying those trends and offering delivery is a really great example of how to combat abandonment. When those prescriptions are left at the pharmacy, that is an obvious impact on the revenue lost on that fill. But what isn't as obvious is the cost wasted having the pharmacy staff fill, check, and prepare that medication, ultimately to backtrack and unsell it and put it back on the shelf. This loss often outweighs the delivery fee. So not only is the return to stock process time consuming and expensive, it takes away from other arguably more important tasks that the staff could be completing, like patient care. And at the end of the day, patients know that delivery exists and they will seek it out if they want to utilize it. So pharmacies risk losing patients who want or need the convenience of delivery if they don't offer it. Offering the solution patients are looking for is obviously another competitive advantage. So knowing that delivery is here to stay, patients want and need delivery, and pharmacies can benefit from it. So next we wanted to dive into some of the delivery solutions and characteristics to look for. It's really important to have a well-rounded delivery solution, and speed of delivery is a big consideration. Each of these service levels listed here has an important place and use case within the delivery portfolio. So starting with on-demand. For this, think Postmates or DoorDash. You place your delivery for your dinner. It's picked up from a driver and delivered to you in a pretty tight turnaround time to your home. Similarly, a driver would arrive to your pharmacy shortly after a delivery request and bring your prescriptions to you at your house. This is a great option for urgent meds, such as antibiotics from that telehealth visit, maybe a temp controlled item or insulin, or changes to hospice care that need to get to a patient as soon as possible. The next one is same day or next day. This is requesting a delivery from the pharmacy and receiving it later today or maybe tomorrow. Patients have come to expect delivery within 1 or 2 days from most retailers. Delivery times that are too long is a really big reason people abandon their online shopping carts. So offering a quick delivery can be a major differentiator for pharmacies, especially those competing with retailers who might only offer shipping. Same day typically entails a pharmacy having a cutoff time before which they can place all of the orders they want to go out that day. A driver arrives, collects all the deliveries, and goes out on a route to deliver them. It's a one pickup to typically several drop-offs, making it a more cost-effective option than on-demand, but a longer turnaround time. And lastly, there's shipping. So shipping is often the most cost-effective option for pharmacies. It would be, USPS, UPS, FedEx, the national carriers. Shipping is often really good for those predictable fills of maintenance meds. Shipping can also help pharmacies attract and retain patients that live too far away for on-demand or same-day delivery. Oftentimes, those service providers can only service within a certain mile radius around the pharmacy. So shipping is a great way for patients who are maybe in a more rural community or who live too far away from the pharmacy, as well as a way to maintain patients who might move or travel for extended periods.
So we do have a question, Emily, that came through. So I saw a recent press release about Uber. Is the on-demand delivery, is that who's providing those services for you?
Yeah, that's a really good question. Yep, awesome that you saw the Uber press release. We're super excited for that partnership, but we are able to work with all of the gig economy providers. So it's not only Uber in that space. There's a lot of players in that space, as well as with our other service levels. We work with a lot of different couriers in order to bring the best solution to our pharmacy partners. All right, so as delivery is becoming a bigger part of our lives and healthcare, there's more and more options available out there. Patients and pharmacies want a delivery solution that meets their needs. In addition to those different service levels we just talked through, here are a few other things we're hearing from the industry. Patients are looking for an easy way to request deliveries. Some patients, that would be an online website or through a patient app. If I didn't get a text reminder that my cell phone bill was ready and needed to be paid and I could pay it with just a few clicks within an app, I would never pay my cell phone bill on time. Convenience is everything for some patients, along with transparency. So notifications and package tracking have become expected with any delivery. As a consumer, I know I want to know when my order from Crate and Barrel is going to come, so I surely want to know when to expect my prescriptions to arrive. Lastly, patients are looking for an assurance of privacy that their data won't be misused. So much like my FedEx driver doesn't need to know that I ordered yet another pair of workout leggings, my delivery driver doesn't need to know what medications I'm prescribed. And then looking at pharmacies, they want a lot of what the patient wants as well, but there's a few additional considerations from the pharmacy's perspective. So they know that a patient might prefer to queue up a delivery from an app if they're like myself, but a lot of them prefer to call the pharmacy. So it's important that the pharmacy also has an easy way for to queue up that delivery on behalf of the patient. And the most ideal way would be an integrated solution right within their workflow that doesn't add time and effort to their day. At ScriptDrop, for example, we have several ways to request a delivery, but they all revolve around saving the pharmacy time and decreasing that administrative burden. And then when you look at secure digital storage of data and patient signatures, or that proof of delivery, is a must in order to pass PBM audits. So working with a delivery partner who can both collect all that necessary information and return it back to the pharmacy in an easily accessible way is key. And then lastly, the courier network of the delivery partner is important. I know some chains or health systems prefer to have the same solution throughout all of their pharmacies. And a lot of delivery partners are too localized to cover an entire chain, so their footprint is something to consider. It's also important to understand their contingency plans. So at ScriptDrop, our goal is to have several delivery partners in the same region to allow us to have backup if a driver is out sick, can't make it to the pharmacy, as well as a way to seamlessly swap out a courier partner without any changes to that internal process the pharmacy's already learned. So we're live in all 50 states, which allows us to cover large pharmacy networks and grow alongside our partners. So a robust delivery offering will meet the needs of both the pharmacy and their patients, ultimately with the goal of improving medication adherence and removing barriers to access.
So we did have a question come in, Emily, and I know you touched on it a little bit, but they wanted to know a little bit more about what does it mean that it's in workflow? So specifically, does that mean that it's within my PDX system or whatever I'm filling my script on, or do you mean that it's in the pharmacy and I'm going to another terminal? If you could just shed some light on that.
Yeah, that's a great question. We have several ways, as I mentioned, to queue up a delivery request. The best way, we know what is most helpful to the pharmacy staff, is to have it in their actual workflow. So within their pharmacy system that they're filling and checking all the scripts in all day. So we're able to have an API integration within that workflow to be able to queue up a delivery within a click of a button. We also have a secondary integration that allows any pharmacy, regardless of their pharmacy system, to be able to queue up a delivery right within their workflow. And then, of course, we do have a portal option. Some people prefer that. Some people queuing up deliveries aren't in the pharmacy workflow, so they need another way. Maybe it's a tech or an admin who wants to be able to queue up deliveries on behalf of the patient who isn't actually in that pharmacy management system all day. So we have a lot of options. We can work with our partners to figure out what would work best for them, but that in-workflow solution really is getting right there in that workflow where they're filling scripts all day, every day. So they're not having to go to that secondary terminal, pull up another website, another portal, and duplicate all of that patient information that they already could have shown us directly from the pharmacy system.
Great, thanks. That was the last question on that one.
Okay, awesome. Before we wrap up, we did want to take a brief minute to look at the players in this space. So there's more choices than ever in the delivery arena now. A lot of retail pharmacies, especially the independent pharmacies, have been doing delivery for years. So it's often with an in-house employed driver, or they were contracting directly with local couriers. And then a lot of us have also received those letters in the mail from our pharmacy benefits manager, letting us know about our mail order options. This is typically for our refills. They offer a 90-day fill at a decreased price. So that's an option out there. But now that delivery is gaining popularity, digital pharmacies who cater to patients are gaining a lot of traction. We all know that Amazon recently jumped into this space, as well as some smaller ones with that kind of have an area or focus of expertise like HIMSS, who focuses on men's health through telehealth consultations. Ultimately, delivery is out there. And as a patient, encourage you to ask your pharmacy about their delivery options. Or as a pharmacy, we encourage you to consider all of your options and find what works best for you. But if you would like to learn more about these options in more detail, we do have them laid out in our 2020 industry report, where we detail all of the different players and kind of give a side-by-side comparison of them to help you explore what option might work best for you.
So we did have a question. So one is, I already have a part-time driver, but the thought of using it within my fill system is attractive to me. Can I use it with my own driver?
Yeah, at least with ScriptDrop, we do have the option where you can use our technology platform both in the pharmacy and on the driver side, to where a lot of pharmacies with their in-house drivers, I'm not sure about your particular experience, but a lot of them are doing paper logs, getting paper signatures. And they have kind of that disconnect of when their orders go out and have that tracking of all of the necessary audit information. So what we can do is we could connect you with our technology platform, connect the driver with our courier platform, and that way you could utilize our system, keep that in-house driver that you have that great relationship with, and we can just kind of connect all of the dots for you on the technology side.
Great, thanks.
So in conclusion, delivery removes obstacles, helps keeps patient healthy, and without a doubt is here to stay.
All right, so if we have any final questions, you can go ahead and send them through the chat function. So again, if you just want to find Luann Myers and then in the chat function, send your question. So we do have a question already, and who is paying for delivery in this scenario? Is it typically the retailer or the patient?
So what we're seeing today is that most of the time the retailers are covering that cost, especially independent pharmacies, health systems. They've historically been covering that cost for the patients. At ScriptDrop, we leave it completely up to the pharmacy partner if they want to charge, if they want to split it with the patient, if the patient's paying. But we do have a few ways that we can help coordinate that with the pharmacy, but ultimately it's up to the pharmacy. But today we're seeing it often covered by the pharmacy itself.
Great, thanks. And then we have another question around marketing. So, I don't have a program today. What are people doing to tell patients about delivery?
So there's really a lot of ways that you could market it. I think the one that we're seeing the most success with is in refill reminders, allowing the patient to know there, hey, your medication's ready for pickup, and we offer delivery. Would you like to opt into it? So that's a really great way to let patients know instantly when their scripts are ready that delivery could also be an option for them. Pharmacy staff do a lot of patient consultations. Word of mouth is the oldest form of advertising. It definitely works here as well. But websites, social media, there's a lot of ways our marketing team can help connect pharmacies who are interested in doing something a little more robust. We have some ideas that we could definitely connect them with.
Great. And then we did have a question around signatures and how are we handling COVID restrictions around not getting signatures? Like, how is that documented in the system for your own?
Definitely. Yeah. So pre-COVID, we were getting signatures on nearly all of our deliveries. We know that that signature is really important to pass your PBM audits. So today, due to COVID, all of the PBMs are still accepting COVID-19 as that acceptable form of signature. So at point of delivery, once that delivery is completed, through our courier application, they're able to note a successful delivery, and that populates the COVID-19 signature, so that when the pharmacy goes back to reference that order, they have proof that it was delivered with that COVID-19. Post-COVID, if we go back to signatures, we do have ways to collect that at delivery, as well as some other information that you would need to know about how that was delivered and to whom. But yeah, today we're making sure we're compliant with that COVID-19 signature.
All right, last call for questions. Are there any final questions? All right. So I think as there's no more questions, we'll just go ahead and wrap up. So if you found this webinar interesting and you'd like to learn or be or know when there's other like-minded webinars or information from ScriptDrop, what can you do to stay in touch? Well, we do have our next industry report, which is coming in June 2021. So much of our content today was based on our last industry report. So we are always staying up to date on what's going on in the industry. So obviously, as we talked about COVID-19 as it relates to signatures, finding out, what's gone on in the industry and how is that continuing to affect delivery. Additionally, stars ratings and readmissions around folks not getting their prescription, that's something that delivery can make a big impact on. So making sure that we cover that in the industry report, we'll be covering that as well. And then obviously hospital at home or hospital without walls, the future of medication access at home is continually changing and is the new norm since COVID. So that will be a report that you can look for on our website. And then if you want to just look throughout the year, we have a blog called The Beat, and that is a great hack on staying up to date with what's going on in the industry. We've got a team of folks that put some really great content on that can help you stay up to date and informed. So lastly, if we can help you or be a resource in any way on you building out your delivery system or you have any questions, please feel free to reach out to us. We have the email listed there on the slide, but we'd love to help you if we can.